Okay, let's unpack this. Imagine a tiny, um, unassuming landmark on your body.
Yeah.
Most of us barely give it a second thought, right?
Right.
Yet it holds secrets to your very first moments of life, it guides surgeons, and it can even, well, whisper crucial warnings about your health.
We're talking about the umbilicus, your belly button.
Exactly. And today, we're going on a deep dive into this miniature marvel.
Hmm.
Our mission, to show you the umbilicus is far more than just, a dimple, as one of our main sources puts it. This is from Dr. Sensil Kumaran K., an associate professor of general surgery. Think of the umbilicus not as a dimple, but as a portal to life, a surgical gateway, and an embryological time capsule.
That's a great quote, and it's absolutely true. For something that seems so simple, maybe even overlooked, the umbilicus is remarkably complex. It's a critical anatomical site.
Yeah.
Yeah, this deep dive will really open your eyes to its importance across anatomy, embryology, pathology, and especially surgery. We'll pull out those aha moments.
Okay, let's start there then. Surgery.
Yeah.
Why is this tiny natural scar so crucial for surgeons? It seems a bit counterintuitive, doesn't it? Like, why there for a major operation?
It's a fair question, but it really highlights the umbilicus's unique advantages. The umbilical port, well, it's the most commonly used primary access site in modern laparoscopic surgery.
The main entry point.
Pretty much, yeah. Think of it as the body's sort of VIP entrance for minimally invasive stuff. The qualities are just ideal.
Like what?
Well, first, it's naturally scarred from birth, so it's already a point of healing. It's largely avascular, very few major blood vessels, so less bleeding risk.
Okay.
It's midline, right in the center, giving direct symmetrical access. And critically, there are no major structures immediately underneath it you could easily damage.
Oh, makes sense.
And the bonus, it leaves the least visible scar. Patients definitely appreciate that.
So a surgical superhighway that's also discreet. Very nice. But it's not just an entry point. You said it acts like an internal compass, too.
Exactly. We can really call it the navel nexus. It's a critical anatomical compass. For instance, it serves as a vertebral landmark.
A landmark for your spine. Yeah.
Typically, it lies right at the level of the intervertebral disc between L3 and L4. That's, your third and fourth lumbar vertebrae, deep in your lower back, around your belt line, roughly.
Wow, that's specific.
It is. And it also lines up with the transumbilical plane, that imaginary horizontal line cutting through it. Super important for reading scans or planning surgery.
Okay.
Plus, it sits just a few centimeters above your ACIS, those bony points at the front of your hips. And it even aligns with the tip of your coccygex, your tailbone, on the surface. Our source really nails it. It's a midline scar, a fibrotic remnant marking life's first separation. A physical milestone.
Incredible precision from such a small spot. And it has other unique features too, right? Almost like a biological sensor.
Absolutely. One key thing, it's a fat-free zone.
No fat.
Right, no subcutaneous fat there, so the layers fuse tightly, making it strong but thin. This explains why hernias there often seem, well, sharp-edged. The defect is really clear.
Okay.
But here's where it gets really interesting for diagnosis. It's a T10 dermatome marker.
T10. What does that mean?
It means the skin right there gets its sensation from nerves originating from the T10 segment of your spinal cord. Clinically, this is huge. Why? Because the initial pain of appendicitis often shows up right there.
At the belly button, before it moves.
Exactly. During the visceral phase, our source puts it beautifully. Appendicitis begins as a whisper at the umbilicus, T10, a silent cry of the gut before declaring war at McBurney's Point.
A whisper before the storm.
Yeah.
Powerful image, and it's a crossroads for more than just pain, isn't it? Lymphatics, too.
Indeed. It's a key lymphatic watershed. Skin above the umbilicus drains lymph fluid generally toward your armpit, the axillary nodes.
Okay.
Skin below drains towards your groin, the superficial inguinal nodes.
And why does that matter?
It's crucial for tracking infections or malignancies. If something's spreading, this tells you which direction it's likely heading. It's a clear boundary.
That's a lot packed into one small area, a real central hub. Okay, let's rewind time a bit. How does the umbilicus tell the story of our very beginnings, our embryonic development etched right there?
It really is an embryological time capsule. Around 4 weeks gestation, you first see this umbilical ring on the front of the developing embryo.
Just a ring.
Yeah, but it was packed. It contained the connecting stalk, umbilical vessels, the vitelline duct, the allantois, even a loop of intestine. Basically the busiest intersection in the embryo, connecting everything to the mother.
All the early lifelines.
Yeah.
And the adult belly button is where remnants of these meet up.
Precisely. It's a confluence, a meeting point of three key embryonic remnants. First, the vitelline duct connected the early gut to the yolk sac if it doesn't disappear properly.
Problems.
Yeah, you could get Meckel's diverticulum, a little pouch in the intestine, or even an umbilical fistula, a direct opening.
Okay, one down. What else?
Second, the olantua, involved in waste, becomes the urachus, which normally closes if it persists. You could get a patent urachus still open or a urachal cyst. You might even see a urinary discharge from the belly button.
Urine. Wow, okay. And the third?
The umbilical vessels themselves. They transform into adult structures, the ligamentum teres supporting the liver and the medial umbilical ligaments in the abdomen.
So these vital early structures normally fade or change, but if that closure process fails,
That equals all congenital umbilical anomalies. Serious conditions like exomphalos or omphalocele, where organs are outside the body, or gastroschisis, similar issue with intestines, it really shows how delicate development is.
delicate indeed. Now, speaking of connections, how does this complex spot get its blood supply? You called it a superhighway earlier.
It absolutely is. The umbilicus sits in the middle of an arterial orchestra. It gets blood from multiple directions. Yeah, a rich crisscrossing network. From above, you've got branches off the internal thoracic artery, like the superior epigastric and posterior intercostals. Think rivers flowing down from the chest.
Yep.
From below, an even bigger network. Inferior epigastric, superficial epigastric, others from the pelvis.
So lots of supply lines, but why is that important?
It's the collateral circulation. They form this amazing arcade, a backup system, like a city with multiple roads. If one major artery gets blocked, say from aortic coarctation, a narrowing of the aorta, or surgery.
The others take over.
Exactly. This network ensures blood flow continues. It's like the body's own insurance policy. A natural bypass built right in shows incredible redundancy.
That's amazing foresight in our design. And this rich blood flow, it also gives us a really important clinical sign, doesn't it? Something you can actually see.
Yes, absolutely. This brings us to the perumbilical veins, also called the veins of Sappi.
Sappi's veins.
These are tiny veins running in the ligamentum teres, that remnant of the umbilical vein. What's crucial is they connect the portal vein system, blood from your gut, going to the liver directly to the veins of the abdominal wall, part of your general circulation.
A direct link between the liver system and the rest of the body.
Precisely. Now imagine portal hypertension, high pressure in the portal vein, usually from liver disease, like a traffic jam in the liver's blood flow.
Right.
Blood gets backed up and looks for escape routes. It diverts through these tiny perumbilical veins.
Into the abdominal wall veins.
Exactly. This overloads those superficial veins around the belly button, making them swell up and become visible, really prominent.
And a test.
That's caput medusae, named after Medusa's head, because the veins radiate out like snakes.
Wow.
It represents reversed venous flow. Blood is being pushed out of the liver. The source says, portal HTN pushes blood out of the liver and the navel becomes the release valve. A dramatic visual sign.
So you see that you know there's serious liver trouble.
Pretty much. And just briefly, if you see veins converging inward towards the navel, that often points to a different problem, like an IVC obstruction blockage of the big vein bringing blood back from the lower body. Different pattern, different cause.
The body drawing maps of its problems right on the surface. Incredible. So when the navel itself sends signals, discharges, swellings, what are the deep secrets it might be revealing?
Well, as our source puts it, if the navel cries, ask, who's calling from within? The type of discharge is your first big clue.
Like a code.
Kind of. Is it pus? That often points to a sinus tract or infected granuloma, fecal matter. That suggests a fistula, an opening from the intestine, likely a persistent vitelline duct.
Yeah.
Then if it's urine, then you suspect a patent urachus, that connection to the bladder didn't close, or maybe a urachal sinus. Each discharge tells a story of a lingering connection.
The story we need to decode. And it's not just discharges, right? Visible swellings, too. A bud at the center of life may conceal either growth or grief. What about those?
The most common one in adults is definitely an umbilical hernia. Part of the intestine pushes through a weak spot.
What does that look like?
Usually soft, you can often gently push it back in, that's reducible, and it might bulge when you cough or strain, the cough impulse.
Are they serious?
In adults, yeah, they can be. More common in women, linked to things like obesity, multiple pregnancies, or fluid buildup, ascites. They have a higher complication risk than childhood ones, which often close on their own, so adult ones usually need surgical repair, often with mesh.
Okay, hernias are common. What else?
Well, in newborns, you might see an umbilical granuloma, a small, pink, moist lump after the cord falls off, usually easily treated with silver nitrate.
Simple enough.
Or omphalitis, that's an infection of the cord stump, often from poor hygiene. See, pus, redness, maybe an abscess, needs antibiotics. And then there are rarer things like Cantrell's syndrome, a complex set of birth defects involving the chest, diaphragm, heart, and abdominal wall. Very serious.
Each swelling telling a different, sometimes urgent story.
Which brings us to maybe the most fascinating and clinically significant detail we've discussed, the ultimate secret the navel can reveal.
Yes. This is a huge surgical pearl, something you never ignore. We're talking about the Sister Mary Joseph nodule.
Okay, what is that exactly?
It's described as a firm, irregular, often ulcerated nodule, basically. A hard lump, maybe with a sore on it, right in the umbilicus in an adult.
And why is it so significant?
Because it's an umbilical deposit of intra-abdominal malignancy metastasis. Plain English. It's cancer that is spread from inside the abdomen, often stomach, ovarian, pancreatic, colon cancer, to the belly button.
Wow, so it's a sign of advanced cancer.
Exactly. Advanced metastatic spread. The disease isn't localized anymore.
And the name? Sister Mary Joseph. That's unusual, not a doctor.
Right. And the story is fantastic. Sister Mary Joseph Dempsey, she was the head surgical assistant to Dr. William Mayo, the Mayo Clinic founder back in the early 1900s.
A highly skilled surgical assistant? Yes. And incredibly observant. She noticed, again and again, that patients coming in with advanced abdominal cancers often had this specific hard lump in their navel.
She spotted the pattern.
She did. She kept pointing it out to Dr. Mayo. He was impressed by her consistency, her clinical eye connecting this small external sign to major internal disease. He started documenting it. Later, Dr. Hamilton Bailey named the nodule in her honor.
That's incredible.
It's one of the very few medical eponyms named for a nurse, a powerful reminder that keen observation is critical no matter your role.
Truly inspiring. But how does cancer even get there? To that specific spot?
Good question. The umbilicus isn't isolated, unfortunately. There are several routes of spread. The most common is probably lymphatic spread.
Through the lymph system?
Yeah, the umbilicus has a rich network of lymph vessels around it, making it a midline lymphatic crossroads. Cancer cells can travel through lymph channels from the stomach, colon, ovary, pancreas, gathering there like whispers from every organ.
Okay, lymphatics. What else, Em?
Direct extension. Tumors can literally, crawl along the membranes lining the abdomen, the peritoneum, or use remnants like the falciform ligament from the liver or the ligamentum teres as a pathway.
The direct route.
And venous spread, too, using those perumbilical veins, the veins of Sappi we talked about with caput medusae. They can act as silent highways for cancer cells, especially from the pancreas or colon to get to the umbilicus.
So multiple routes lead there.
Yes, it's a grim signpost. Sadly, the prognosis for someone with the Sister Mary Joseph nodule is usually poor, life expectancy often around 10 to 12 months.
Such a small nodule, such a profound message. So wrapping this up, what does this all mean? We've gone deep into the umbilicus, this tiny scar holding a monumental story. We've seen it as a surgical gateway, an anatomical map reference, a living link to our embryonic past, a vascular hub, and even this critical diagnostic beacon. It's really a miniature masterpiece.
It really is. And if you connect this to the bigger picture, it just highlights how even the most, unassuming parts of our body can hold profound insights into health, into disease.
Yeah.
It teaches us, I think, to look closer, to really observe, to listen to the body's whispers, because sometimes those whispers are telling us the most critical stories, things we can't afford to miss.
So, next time you happen to glance at your navel, maybe give it a little more thought. Consider its incredible journey, all the secrets it holds, and maybe wonder what other simple parts of our body might be silently telling us crucial stories, just waiting for us to look a little deeper.